According to Franco Postacchini, author of the book Lumbar Disc Herniation, the condition can cause on an average up to 20 days of lost work annually for the employee. Statistically, the most common patient is twice as likely to be male, aged 35 to 54, and 90% of the time occurring in the lower lumbar portion of the back. But what exactly is a disc herniation, and how do you get it? Dr. Ronzo of Gulfcoast Spine Institute explains.
Disc herniation is when the soft cushion material that normally resides between the bones, providing a shock absorber, gets pushed out of its encapsulated area, and typically gets pushed out and becomes a problem if it pushes out towards the nerves. So the nerves are behind the disc. So if you're doing something strenuous, heavy lifting or bending, or a combination of bending, lifting, and twisting, or you take a hard fall and you get a lot of pressure on your back, you can squeeze out that jelly inside portion of the disc. It ruptures through the wrapper, and then if it ruptures towards the back and happens to be pushing on a nerve, then you get that nerve-related pain. So patients will come in not just with back pain, but with pain radiating down an arm or a leg, depending on which nerve is being irritated. I think what sets us apart at Gulfcoast Spine is that we do almost all of our surgeries in the lumbar spine through minimally invasive techniques. That's a surgical technique that is growing, but still, I would guess only about 15% of spine surgeons are utilizing it. With the minimally invasive surgery, we're able to make small incisions, work through the muscle, essentially underneath the muscle belly, and do the exact same process on the bone, whether it be to stabilize it or take pressure off a nerve. And then when we withdraw these small tubular retractors through the muscle's left unharmed and works and functions properly. I think if somebody's living with chronic debilitating back pain and their quality of life has taken a hit and they're no longer doing the things they enjoy, whether it's dancing or golfing or playing pickleball, then they should consider their surgical options.
Ronzo cites some of the benefits of minimally invasive surgery as less blood loss, less tissue damage, minimal scarring, and quicker recovery time. Need to know more about minimally invasive spine surgery options? Gulfcoast Spine Institute has offices in the Villages, and you'll find the contact information in our specialist directory at yourhometownhealth.com.